Temiem lanutrem tandaipa anogonong topic impact of substance abuse in pregnancy. Chimbitsi kanam maunga akatsinong youth ministry tangkanga pelaba matataksir iba topic achanga asunok achak tangazakpa angutsi amanger. Ni asunok achak convenience aduma English nong chimbir. Substance abuse. What is substance abuse? It is the use of excessive amount of drugs, alcohol, tobacco that is injurious to the individual. It not only affects physical, mental well-being of the individual, but it also affects the society as a whole. And it can also lead to criminal activities. Now, substance abuse in pregnancy, it is becoming common these days as the substance abuse rate in women of the reproductive age group, it is increasing at an alarming rate. Now, a pregnant lady, she is supposed to take around, say, 3 to 4 tablets medications during the entire course of pregnancy. Now, during the antenatal checkup, that is the care given during pregnancy, the attending doctor can take it as an opportunity to detect and identify all those women having this substance abuse disorder. The doctor can do so by taking a detailed history of substance abuse, doing physical examination, as well as certain tests can be done so that the treatment of the patient can be done at the earliest and further complications in the growing baby can be prevented. Now the doctor should ask about the type, the amount and frequency of substance abuse in a non-judgmental manner. Then the consequences of substance abuse should be explained with emphasis given on her physical, mental and emotional needs. Participation from husband, partner, family members, friends, well-wishers will also be required in case the patient is in denial. Now, what are the probable causes of substance abuse? Various studies have been done to identify the causes of substance abuse. And they are, number 1 is genetics, number 2, stressful life, number 3, limited social participation, limited social life, easy access to alcohol, tobacco, illicit drugs, low self-esteem, trauma, identity crisis, mental health disorder, eating disorder, reproductive problems. Now coming to effects of substance abuse on the mother and her baby. Effects on the mother. Effects on the mother can vary from respiratory problems to heart problems, kidney-related problems, liver problems, sexually transmitted infections like HIV, vitamin deficiencies, psychosis. Now, coming to the unborn baby, it not only affects the unborn baby, but also after the baby is being born, and it affects the developing child. Now, alcohol abuse during pregnancy. Alcohol use during pregnancy, it is associated with increased risk of spontaneous miscarriages, low birth weight, premature deliveries, and intrauterine growth restriction of the fetus, that is the baby. Alcohol, it hampers the normal functioning of the placenta. So the essential nutrients to the baby is being restricted and thereby causing the restriction of the growth of the baby. There is one syndrome called fetal alcohol syndrome, which results in mental retardation of the baby, developmental defects, abnormalities of the genitourinary system, Complications are seen in all cases of drinkers, chronic drinkers, moderate, light, heavy drinkers. Now, tobacco use in pregnancy. It increases the risk of stillbirth, fetal growth restriction, sudden death of the infant, unexplained death of the infant. Cocaine abuse in pregnancy. Cocaine abuse, it causes decreased blood flow to the baby, thereby increasing the heart rate of the baby. Cocaine use in early pregnancy is associated with increased risk of miscarriages, whereas use in later part of the pregnancy, it can cause premature delivery, low birth weight, intrauterine growth restrictions, fetal death, neurodevelopmental disorders, gastrointestinal disorder, and kidney problems of the baby. Marijuana use in pregnancy. Marijuana is a commonly abused substance. It is seen in about 25% of women in their reproductive age groups. Complications of marijuana is dependent upon the dose, and it is associated with increased risk of fetal growth restriction. Opioids use during pregnancy. It affects the newborn's central nervous system, respiratory system, and gastrointestinal systems. It may lead to prolonged hospitalization. Baby shows signs of irritability, poor feeding, temperature instability, and difficulty sleeping. Heroin abuse in pregnancy. It is associated with 50% of the cases of low birth weight babies. Majority of the babies born to mother dependent on heroin shows signs of addiction. There is impaired central nervous system and respiratory system, gastrointestinal system in the developing infant. Now, management and how to treat a substance abuse mother. Abstinence should be the ultimate goal of treatment, and it should be designed in such a way that the needs of the mother is met, and it should address the concerns of the woman. Active participation during the prenatal checkup. It can be done to improve the outcome of substance abuse pregnancy. Stopping the substance use can further decrease the complications in the fetus, that is the baby. Pregnancy is a strong motivator for abstinence, as most of the women stop or decrease the substance abuse, that is tobacco, alcohol use during pregnancy. Now, what are the reasons for treatment failure? Poor social support, failure to identify substance abuse mothers, poverty, fear of loss of custody of the child. For a successful treatment, we all need to have multidisciplinary healthcare system, family support, parental skills training, and psychiatric services. Now, the take-home message. Substance abuse in pregnancy is a global health issue because it affects the health of the future generations of our country. Substance abuse during pregnancy is difficult to detect, but the doctors can do something about it. They can include a detailed history taking on substance abuse in every new patient and follow-up questions in subsequent visits. Once substance abuse is detected, abstinence should be the ultimate goal of treatment. By increasing awareness of the complications of substance abuse in pregnancy, we can improve the overall health of our country. Thank you.